Welcome back. In our life, we or someone we know will face some kind of trauma, whether it's from drugs, violence, a mental health issue, or something that throws our life into a tailspin. We want to first introduce you to a gentleman whose incredible story of horror and survival was featured on Oprah. William Kellibrew will be speaking at a behavioral health conference in Charleston, West Virginia. He spoke by phone recently with our Kathy Paxton.
William, what brought you to this work?
That's a great question. I kind of feel like I was indoctrinated in a sense to the field. First of all, I was sexually abused, in fact, violently sexually assaulted at 6 years old. And then at 10, I witnessed my family get executed in our living room, my 12-year-old brother, my mom, and I also was assaulted at gunpoint and held hostage. And so, you know, I survived that, but had no idea that the next 20 years would be the struggle that I would face every single day, getting up and not, you know, having a clue sometimes about where the next move was. But I finally got on track and stopped running away from trauma, and then I moved closer to it, and it's just been an awesome opportunity.
That's wonderful, and I've been fortunate enough to hear you a few times. But what do the folks in West Virginia, what can they look forward to hearing about, and what do you hope to share with them in September?
Yeah, so I want to share one of the points that I'm going to share is the role that values play in healing. Well, I don't think we talk enough about values. Richard Barrett said once that our values and beliefs drive our decision-making, our actions and behavior. What he says is that our actions, what we do, how we act, may be directly and can be directly linked back to our values and belief system. And so trauma disrupts that belief system. And so how do we address that to support individuals getting back to that place where they're safe emotionally, psychologically, they're safe physically? And that's the point that I'm going to make in our system, because I think when we focus on values, we really focus at the core of how to get back to that safe place. And so I'll focus on values and healing is a big piece, and of course a trauma-informed approach, taking an approach to support individuals in addressing their own trauma, but also being aware that, you know, their behavior impacts others around them.
That's great, and we look forward to seeing you September, and thank you for your time.
And joining me is Kathy Paxson, Director of the Division of Alcohol and Drug Abuse. Kathy, what a powerful story.
Oh, it is.
I mean, you know, it's very heartwarming to know that there are people that struggle and can survive and then live as an example to others. And I'm sure it struck you the same way.
Oh, absolutely. We've known William for a few years, and he, along with some other folks that have lived experience, are going to be a really specific piece in this year's conference and event.
Tell us about this conference, because I think it's very important for our viewers to understand the value of the Integrated Behavioral Health Conference and what that does to bring people together to understand about trauma and its impact on substance abuse and how these things we can learn from each other. And what is it that this conference brings to West Virginia?
Well, this is the second of this bringing folks together, and it is the West Virginia Integrated Behavioral Health Conference. It is September the 22nd through the 24th, and it'll be at the Charleston Civic Center this year. And we had approximately 800 folks at the first event, and looking to have even more this year. And I think, I guess our focus is really on building trauma-informed approaches across the whole spectrum and across populations. Oftentimes we're siloed in our efforts, and this is to bring everyone together to network and learn together.
Can you go over a few of the things that we'll learn in that conference, just so our viewers are aware of the things that we're bringing into the state that are really evidence-based, that are, I think, important for all of our providers to know, and that really goes across not just behavioral health providers, but we're talking about law enforcement, we're talking about social services, we're talking about anyone who works with people in need?
Well, I guess for me, again, there'll be a focus on trauma for all ages and different groups and different populations. But some specific things, I think it'll be a good focus on clinical supervision, teaching those folks how to really supervise individuals with regard to trauma-informed approaches, as well as there'll be some new trends and topics. Everything from equine therapy that's used across all disabilities to canine therapy used with veterans and veterans programs. There'll be many skill sessions that folks can not just learn about hot topics and current best practice, but also come away with a skill such as motivational interviewing or learning how to engage children and their families in treatment.
Why is that important right now? I know that, I think we're undergoing a transformation. I think we have really focused with, beginning with the governor's efforts on with the Governor's Advisory Council on Substance Abuse and that executive order with all the other things that we've been doing. What does this bring to the table for West Virginia that's unique and different?
Well, I guess the value of folks coming together is we're not treating folks in isolation or silos anymore. We're really looking at the whole person, at the physical health as well as the behavioral health. And it takes everyone to do that, particularly with, and I'm speaking to substance abuse specifically, and you'll hear law enforcement say they can't arrest their way out. And we can't treat our way out. We all have to work with the individual and the communities. From kind of that top-down, bottom-up approach, from the grassroots organizations to our state government and our lawmakers.
Now, who should register and come to this behavioral health conference? Tell me across disciplines, the type of individuals we're looking to bring together for the conference this year.
Well, I'm biased, but I think everybody should be there. This year, we're having family-friendly events as well. And some workshop sessions, so people from the community, not just our providers, but of course all of our behavioral health providers, law enforcement, physicians, anyone in the helping field. So many of us share those populations, criminal justice, and I think it's us coming and learning together, and I think that's the best way that we can treat individuals in doing that.
I know there'll be many stories shared, such as William's story about how people are able to overcome obstacles with support, and I think that we'll be learning about evidence-based practices and different things that we can do to support each other. Are there any sessions where there really is a chance for networking among providers who may not know each other and they can learn from each other?
Absolutely. I think there's several ways they can do that. We have one particular area that'll be just about self-care because many providers who are in this field, they don't take that time and opportunity. So there'll be that time that they can come, and it's kind of, a lot of conferences have recharging stations for their phones. This is recharging stations for providers. And so I think this will be that opportunity for them to network. I think in the evening, we have 2 evening events. A concert by Templeton Thompson, and also another event that is based on families and helping them to help their kids online and online safety.
How do people register if they'd like to come to the conference? What's the process?
Probably the easiest way is to go to the BHHF website, the Behavioral Health and Health Facilities, or you can just go to the Department of Health and Human Resources website. And click on the behavioral health and then click on conference. It's a very long website, or you can just Google BHHF and it'll pop right up.
Now, if you're interested in going to, I know it's a multi-day event. Is there opportunity for people to selectively go for a certain day or for certain sessions?
Well, it's really affordable, a lot of value added, and the partners didn't do a cost. But we want folks to realize that they can scholarship if they can't afford to go to all 3 days and then attend one. That is fine as well. But we think it's a real good opportunity. Meals are included as well.
Great. Well, it sounds like that we're all set and ready to go, and I appreciate you coming and speaking about it today. Thank you, Kathy.
All right. Thank you.
That's all the time we have for today's show. Remember, you can always follow us on Facebook, Twitter, and our website. I'm Karen Bowling, Cabinet Secretary for the Department of Health and Human Resources. Thank you for watching The State of Health here on the Library Television Network.